Technology moves fast, and sometimes agencies have to reorganize just to keep up. That's the case at Health and Human Services, which last month reorganized to, quote, streamline and bolster technology, cybersecurity, data and artificial intelligence and policy functions. Here with what that all actually means, the Assistant Secretary for Technology Policy, Micky Tripathi. Mr. Tripathi, good to have you back.
Thanks, Tom. Good to be here.
And this whole office, the Assistant Secretary for Technology Policy, and your title, that's newly named as part of the reorganization, correct?
It is. Yep.
Well, tell us more. What has happened here? There were 3 different offices handling all of these tech-related functions. Tell us what drove this idea to reorganize.
Yeah, so there's a number of different things that, kind of came together all at the same time. We've been working very hard since I came in January of 2021 and under the leadership of Secretary Becerra and Deputy Secretary Palm, we've been, doing more and more at the department level related to technology and data strategy, things like the HHS data strategy, the HHS cybersecurity strategy, and AI, obviously, more recently. And what we've been seeing is that, data, technology policy, and operations have grown significantly, both at, kind of at the department level, as well as within each of our operating and staff divisions. And increasingly, those are, being recognized as kind of core functions of the department. They're not just, kind of an administrative thing that, let's do this at lowest cost. We're recognizing that these are more and more, strategic things that we need to be thinking of as real core functions that are critical to the mission of the department and all of our agencies. So as we looked at that, responsibility for these various elements have been distributed across my office, ONC, ASA, the Assistant Secretary for Administration, and ASPR, the Administration for Strategic Preparedness and Response. And we looked at that and thought, we really need to reorganize this to streamline and strengthen the department's technology, cybersecurity, data, AI strategy, and policy functions. And that'll also, enhance and consolidate our policy guidance, talents, delivery capacity, all of that, so that we can, really be in a better position to meet the urgent needs of the moment and ensure that we're positioned organizationally to keep pace with developments in the future. So specifically, we've, under the reorganization, oversight over technology, data, AI policy, and strategy are moving from the Assistant Secretary for Administration, the CIO's office, and are being consolidated in ONC in a Chief Technology Officer, Chief Data Officer, and Chief AI Officer that's now called the Assistant Secretary for Technology Policy. And ONC is going to be duly titled ASTP and the Office of the National Coordinator. And then another part of it, and I'll stop in a second, another part of it was taking certain cybersecurity functions that were in the Assistant Secretary for Administration's office and the CIO's office as well, and moving those over to ASPR to consolidate our cybersecurity, resources and staff components. So those are all under ASPR. So now what you've got is cybersecurity under ASPR, enterprise IT functions under the CIO, and strategic uses of technology and innovation and data and AI under the Assistant Secretary for Technology Policy.
And given the former title of your office of National Coordinator for Health Information Technology, it sounds like you're making a distinction between the technology based to operate the department, personnel, finance, acquisition, all of those things that every agency does, and keep that somehow separate in focus from health information technology because of the vast amounts of health data within the different components of HHS and the fast-moving way in which that's being employed as technology moves on with AI. Is that a fair way to put it?
Yeah, I think so. Looking at what ONC has, traditionally been doing over our 20 years, we were founded in 2004. It really was in the area and continues to be. I mean, we're not losing any of our core mission. Continues to be in the area of technology strategy and data strategy in the, domain of health information technology. And that was true, both in working with the sector. So things that we do for data standards that are required to be supported by provider organizations and electronic health record systems, for example, certification of electronic health record systems, for example. And then also working with our federal agency partners to make sure that CMS quality measures, for example, are rooted in those same data standards, and CDC public health reporting is based on those same data standards. So we work, both with the market and the sector and with our agency partners, but in health information technology. And what this represents is basically saying, well, we've already got that chassis built where we've got those deep collaborations with our agency partners. We're very market facing. We work with the market in all of these areas. We ought to, build on that chassis to say, well, maybe we ought to, as we're thinking about technology strategy more generally, not just in health IT, let's build on that chassis and start to add those things because you've already got the capabilities, combining technical, regulatory, and policy expertise and experience here at ASTP.
We are speaking with Micky Tripathi. He's the Assistant Secretary for Technology Policy, a new title at the Department of Health and Human Services. And if you look at some of the big HHS components that are large repositories of data and AI application, exploration, etc. in their own right, I'm thinking of CMS, NIH, the CDC, and the FDA come to mind, but there's others too. But if you take those four, those are major planets of data in their own solar system in some ways. What's the relationship with them as they pursue whatever their missions are in using their data, such that at the HHS level, there's some cogency and assurance of standards?
Yes, absolutely. They are major planets, and the department is, kind of the big solar system or galaxy that tries to, sort of have all of them have their individual mission focus, but keep them in the orbit, right? So that's the ongoing, kind of activities. So really, the activities that we've been doing, ONC from in health IT, have been working very directly and explicitly with our agency partners. So we do a ton of work with CMS, CDC, FDA, NIH on advancing their uses of health information technology with respect to data, for example, with respect to leveraging things like TEFCA, which we talked about before, nationwide network interoperability, FHIR APIs, which are modern, internet APIs. So that's work that we've already been doing. And in a way, this is no different in terms of the types of relationship and the balancing of being able to help them with their individual mission focus and the innovative, flexibility that they need to be able to have, but the alignment at a department level with what all the other agencies are doing and what we're trying to accomplish with the, as the department itself. So yeah, all we're really doing is saying that we ought to be thinking in that same way as we think about AI, as we think about the strategic uses of data across, our agency partners, and in the innovative uses of other types of technologies like identity management, things like that, as we move forward.
And from a practical standpoint, reorganizations are easy to draw on graph paper, really hard to effect in terms of people's hearts and minds. And I'm imagining some people have new reports, managers have new people reporting to them, people might even be physically moving. How is this executed at the human level or at the personnel level?
Yeah, I worked with the federal government a long time ago, so in some ways I'm coming at it fresh in my 3 years, and I will certainly say that doing a reorganization in a government agency is not for the timid or the faint of heart. It's definitely a very engaged endeavor, for good reasons, right? I mean, these are very important institutions, and we want to make sure that that we've got all the checks and balances that are covering all of the bases and all of the different issues that could arise with that. So we did did a lot of work, and the Deputy Secretary's office was instrumental in helping to lead this effort as we, thought about the strategic need for what we need to be able to do and how we need to be able to think about that and work with our agency partners, in getting that accomplished. So there was a lot of work, over the past 12 months, really, in setting the stage for this as a formal reorganization. But I will say that one of the things that I think really helped a lot was that we were already doing a whole bunch of these things. And I think that there was broad recognition across the department that we were already doing these things. And it was really much, much more ad hoc, that as we saw the need for these kinds of technology strategy things, the Secretary's office, the Deputy Secretary's office, and ONC were kind of rolling up our sleeves on an ad hoc basis, putting together ad hoc teams to scramble and meet the needs of the moment. And we were successful. We didn't drop any balls, but that was when, sort of the recognition was, we can't keep doing this as an ad hoc activity. We need to, at this point, recognize this is the future. And so let's dedicate those resources. So there's certainly a lot of work to make sure that the proper discussions were happening, that people weren't surprised, that there was a good understanding of the motivation behind it. But as I said, a lot, for many people, it was almost formalizing what we were already doing on the ground. So that made it, certainly a lot easier as well.
And just a final question, getting back to that galaxy of data question we were talking about a moment ago. Do you ever imagine that in all of that data that CMS, NIH, CDC, FDA, SAMHSA, there's just so many, if it could somehow be aggregated, the answer to every question medically and health-wise is already in there somewhere?
Yeah, that's a really interesting question. I think that we need to, and the American people need to recognize that the federal government does not